Hi everyone, Dr. Jeff with you this week. Flying solo. Our co-student Maya is feeling under the weather this week, so I'm here on my own. But our topic this week is something called active release therapy. ART is short. It's kind of a soft tissue technique that a lot of physios and chiros and massage therapists use. And it's kind of a massage in motion, essentially. So we're actually moving the joints and moving the muscles, and we're trying to get our hands inside the muscle. We're trying to realign the muscle fibers, trying to get the strength back in it. We're also trying to, we talked before about how nerves can kind of get entrapped inside soft tissue, inside ligaments and muscles and tendons. The other good thing about ART is really good at trying to, again, slide that nerve through these contracted tissues and try and release the nerve from the surrounding tissues. So that's what we're going to talk about today. We'll get a demo going and we'll get right at it. So when we're dealing with nerves, with ART, one thing we're going to talk about today is we're going to talk about carpal tunnel syndrome. And that's where you get tingling and pins and needles and stuff in these 3 fingers and your thumb. Worse at night, kind of have to shake it out. Carpal tunnel syndrome, the median nerve actually starts up in the neck. So we're going to come in up here. We're going to kind of go after the scalene. So the brachial plexus, the nerves come out all kind of attach and start going down through the neck here. So we kind of come in and we start to kind of go along the nerve track, see if we can kind of stretch that nerve through the muscles there. And one thing with ART is it can be quite uncomfortable when we're doing it, actually quite painful. You feel much better when we're done. So we kind of track that nerve through there. So next place we're going to look at is through the bicep, come down to the bicep. And then once we're down the bicep, there's another spot in the triangle, the elbow here we look at. And then coming down, generally a lot of people with carpal tunnel syndrome, that's because the carpal ligament is too tight. And the nerve is getting trapped in there. So again, we kind of follow the nerve down through there, into the carpal ligament, and then into the hand, and sometimes in through the thumb there. So a real ART session would take much longer than this. This is kind of just an overview of what we would do as far as dealing with something like carpal tunnel syndrome and using ART. We also use ART on muscles. So one common thing we do is like a tennis elbow. And if you watched our drumming video a few weeks ago, one issue we have with drummers is they get tennis elbow or tendonitis in the elbow. So Maya has that. so with that, generally the extensor tendon brings the arm up and down like this, and the supinator kind of turns the arm up like this. Those are the 2 we kind of deal with this. So again, we're coming in, we're going to go along the muscle track. This is quite tender for Maya. Muscle track here. You can actually feel almost where the muscle itself has kind of tied itself up into a knot. You can actually feel the issue in there. And again, we're just kind of taking that muscle, putting it through its range of motion, trying to get my hand inside the muscle belly and the fibers, and we're trying to realign those fibers. And one thing you find if you do a pre and post test with ART is generally if you're doing it on muscles, you're going to find that their strength returns when you're done. This is really cool when you're doing a supraspinatus muscle at a shoulder. When you test them before and after, beforehand you'll actually push their arms right down, and afterwards they can hold their arm back up again. So again, this is a little bit of golfer's elbow on the side here we're working on. So that's what we do with ART. It can be quite uncomfortable, but the whole idea is we're trying to take that muscle. Massage is a static thing. We're just lying on the table and then massaging and trying to break up any knots in the muscle, whereas with ART, we're actually trying to move the muscle and slide the muscle, trying to get inside the fibers and get the fibers realigned so you get your strength back. And we're doing with nerves, we're trying to get the nerve stretched out, the nerve uncontracted through the tissues, and that will actually get your tingling and again any strength and stuff back afterwards. So if you like our video, give us a big thumbs up, share with your friends. We always like when you share. If you have any suggestions you want to give to us, send them to us and we'll be happy to investigate that for you. And as always here at Goals of the Chiropractic, we got your back.